In virtual cardiac rehab, a program coordinator connects a patient to their care manager by getting them enrolled in the program. This video provides an overview of how we typically present the program to patients.
First, we provide them with the program flyer and explain what cardiac rehab is. Cardiac rehab is the next part of the recovery process after having a recent admission for a heart event, surgery, heart failure, or coronary artery disease. It is both a treatment and a secondary prevention program in which you receive continued education on how to manage your risk factors for cardiovascular disease. The goal of cardiac rehab is to help you safely resume physical activity, improve your quality of life, and reduce your likelihood of future heart events and readmission.
We inform the patient about the program and that a care manager will work with them through phone calls and the mobile rehab app. We emphasize that the patient does not have to come into a facility. They can do the program from the comfort of their home.
Next, we describe the educational calls with their care manager. Most programs start out with weekly calls for the first month reviewing topics such as risk factors for cardiovascular disease, stress management, nutrition, and exercise. These calls will shift to being bi-weekly, monthly, or bi-monthly over the course of the program.
Patients often want to learn about exercise throughout the program, so we describe how their care manager will work with them to create an exercise regimen that is both safe and enjoyable. We explain that having access to equipment may be beneficial, but it's not required. For example, walking is a great form of aerobic activity that can be performed safely in many settings.
Each patient receives a kit that helps them track their vital signs. Kits include a blood pressure cuff, an activity tracker, a weight scale, resistance bands, and an educational booklet. We set up and train each patient on how to use the app and these devices, and we let them know that support staff is always available if they encounter any technical difficulties.
Sometimes, patients want to understand the benefits of virtual cardiac rehab as opposed to traditional cardiac rehab. With virtual cardiac rehab, many patients report that not having to be on site 3 times per week is what allowed them to participate. They can exercise when they choose, and the educational calls are scheduled at their convenience, with the highest frequency of calls being once per week in the beginning of the program. For traditional programs, scheduling difficulties and reliable transportation often excludes them from participating.
Another benefit is having vitals tracked and monitored from home. In addition to the patient's cardiologist providing a referral for the patient to participate, care plans and progress updates are reviewed and approved by a supervising medical director throughout the program. Patients can also chat with their care manager and report symptoms in the app as needed. While patients are educated on emergency planning, the rehab staff does not monitor the system 24/7, so we do remind them of the importance of continuing to communicate with their doctor and calling 911 in cases of an emergency.
Members of the household and other supportive peers can also engage in the program. By participating in the educational calls and activities, they can help the patient reach their goals. Once the patient is interested in participating, they will be connected with a program coordinator who will enroll them, get them set up, and schedule the first call with their care manager.
The patient then works one-on-one with their care manager throughout the rest of the program, who will help them learn how to manage their risk factors for heart disease, reach their goals, make progressions as appropriate, and maintain heart-healthy living for life.
Going through a cardiac event is a life-changing experience. It can be scary and leave some with a lingering fear of the unknown. Our highest priority is to support you through one-on-one interactions with our team of trained clinical and support staff. We are able to provide the tools and resources to help you regain control of your heart health and your confidence.
Thank you, and we look forward to having you in the program and assisting with your journey to recovery.